This is our project on Ehlers-Danlos syndrome.
Ehlers-Danlos is a group of inherited disorders that mostly affects the skin, joints, and blood vessels. Ehlers-Danlos syndrome affects connective tissue, primarily the skin, joints, and blood vessel walls.
Common symptoms are skin with high elasticity, which makes the skin around the face and neck especially susceptible to breakage and or bruising. Weakened connective tissues make dislocation and hypermobility very common among patients, and in some cases, weakened blood vessels and or organs are common as well, resulting in some later in life issues.
And people may also experience pain in joints or muscles. They also experience bleeding, double jointedness. They get bruised easily, and they might get a heart murmur. Risks is that fragile skin may develop prominent scarring. People who have Ehlers-Danlos syndrome, vascular type, are at risk of often fatal ruptures of major blood vessels.
Some of the other risks are, as mentioned, joints that are very prone to dislocation and dislocation past further injury. The easily stretched elastic skin can be bruised and damaged a lot easier than normal skin. Skin translucency and being able to see the veins through the skin is also common. Wound healing is delayed because of improper skin development. Heart murmurs are also a very common but less serious risk, and other physical deformities can develop. Ehlers-Danlos is more often seen in women than men, but isn't uncommon among males. The disease is hereditary, meaning it can be passed down from generation to generation. Although Ehlers-Danlos may cause organ problems, those with it are expected to have an average lifespan, and it is fairly unaffecting to the family members of patients or further family members in the future.
Treatment includes supportive care, therapies like physical therapy, and medications like nonsteroidal anti-inflammatory drugs. Treatment depends on severity, but it can help manage symptoms and monitor for complications.
Learned that this disorder can be fairly minor and lead to simple bruising and hypermobility and underdevelopment of the cardiovascular muscles, and as well can cause ruptures in major blood vessels and have internal hemorrhaging. Both my stepbrother and my stepdad have this condition and have been fairly unaffected by it.